Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to get into a disclaimer and reminder before getting into the questions, just that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see, I design and create based on the guidelines that are currently being tested on the ANCC exam as well as the AANP exam. Now, any of my videos that I'm teaching on things that we currently do in practice, I will always say that so that there's no confusion, okay? So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office with complaints of sudden vision changes. He states that it appears as a curtain is blocking his vision. He denies any recent injury to his eyes. What is the next best action by the nurse practitioner? Is it A, to prescribe Timolol drops? B, refer to the ER? C, prescribe Timolol and have patient to follow up in 1 week? Or D, nothing at this time, continue to monitor? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so it allows you to slow down and ensure you're answering what they're even asking you in this question. So here, the stem of the question states, what is the next best action by the nurse practitioner? All right. So, all right, we're looking to see what we need to do. And next best action is basically your planning, your treatment. So, what do you need to do next, right? And so, I always tell you when that question is asked, you need to run it back and see what the diagnosis is because we can't plan to treat or anything if we don't have a diagnosis or have a differential to kind of know what we're directing towards or how to move, right? So run it back and see what we got. So here, patient presents with complaints of sudden vision changes, right? So you're starting to think of those visual issues that you may have. He states that it appears as a curtain is blocking his vision. So here, when I say this, you say that, right? Type thing. Knowing those key identifiers. That curtain closing, that curtain blocking is classic for angle closure glaucoma, right? So then you need to think to yourself, all right, could this potentially be angle closure? He did say this was something that suddenly changed. He denies any injury to his eyes or anything. So with angle closure, because it is an emergent issue, you want to refer the patient out to the ER for emergent evaluation and treatment, right? Because this can lead to blindness, complete visual loss, right? So I always say with my Brittany's Brilliance to think of it with open angle glaucoma versus angle closure. With open, although you are having vision changes, they are gradual. So your eyes are still open. You can still see, but you're beginning to have those gradual changes, right? They may present with those minimal vision loss, and they'll tell you over time they notice it's worse. That's when we prescribe those timolol drops, the patimolol drops, those beta blocker drops, right? Because it is that increased intraocular pressure that is contributing to this. So those beta blockers will help with the reduction of that, right? Whereas with angle closure glaucoma, I say, this is rapid, sudden changes. You don't want the eyes to close, meaning we don't want it to lead to complete blindness, right? So you want to send them out for emergency management immediately so that they can do all the steps and things to prevent complete damage and blindness, right? So you don't want the eyes to close, angle closure, curtains closing, all that ties together, right? So just think of that when you are reviewing. All right, question number two. The nurse practitioner has diagnosed a patient with otitis externa. How should the nurse practitioner treat? Is it A, polymyxin B and hydrocortisone drops, B, azithromycin, C, levofloxacin drops, or D, nothing, it will resolve on its own? Take a moment and tell me what you got. Tell me what you got. Tell me what you got. All right, so stem of the question states, how should the nurse practitioner treat? Again, if we are treating, you want to run it back and see what the diagnosis is. See if they have provided you with a diagnosis. And if they have not, you need to run it back a step further and look at and find those assessment findings. How are they presenting? What has the nurse practitioner assessed and noted? You need to get all of those signs and symptoms, presentation, and everything to come up with that diagnosis. But here in this question, they have a diagnosis. They have already told us otitis externa. So you need to know how we treat otitis externa, right? So is it A, polymyxin B, and hydrocortisone drops? Yes, that is the best answer. Just simply because polymyxin B and hydrocortisone drops, ciprofloxacin and hydrocortisone drops. These are the first line therapies for otitis externa. Just simply thinking of this, we want an antibiotic to treat the infection, correct? And then those hydrocortisone drops also are steroids, right? So it'll help with the inflammation, which in turn will help with that pain because commonly, people come in with these ear infections and they have the ear pains. Um, so these combination of drops will help to eliminate the infection and also treat the symptoms. But you also know you can include symptomatic management like your NSAIDs, Tylenol, etc., for management and treatment of pain and fever. Azithromycin, no, we're not just straight out giving antibiotics. Levofloxacin drops, again, it's ciprofloxacin. Remembering levofloxacin is a respiratory fluoroquinolone, right? Remember my Brittany's brilliance to remember your respiratory fluoroquinolones is Get My Lungs, which is your gemofloxacin, your moxifloxacin, and your levofloxacin. So although it is a quinolone, that is a respiratory fluoroquinolone, not our standard, right? So and then D, we're not going to just leave it, and not do anything, right? All right. And question number 3. The nurse practitioner and NP student are discussing CURB 65. When scoring, when should you consider referral for inpatient management? Is it A, when all of the criteria is positive for positive scoring of CURB 65? Is it B, 2 or more positive of CURB 65? C, 1 or more positive of CURB 65? Or D, CURB 65 is used for treating pneumonia and not scoring the severity of pneumonia? Take a moment and tell me what you got. All right, so stemming the question states, when scoring, when should you consider referral for inpatient management? All right, so the nurse practitioner and NP student are discussing CURB 65, right? So what is CURB 65 is the first thing you need to think about. CURB 65 is utilized to score the severity of pneumonia and to deem when you should consider and when it's warranted referring them for a higher level of care inpatient, right? So when somebody has pneumonia and you're doing the score, the C is for confusion. Are they confused? If you noted any confusion. U is for urea, right? So you're looking at that BUN. Is it greater than 19? R is for respirations greater than 30. And B is for blood pressure, a systolic less than 90, diastolic less than 60. And then the 65 is for the age, 65, right? So out of those 5 things on the scoring criteria chart, if you have 2 or more that are positive, then you need to refer them out for a higher level of care and consider referring them for inpatient management. So A is incorrect because we don't wait for all of them to be positive, right? B is your best answer, 2 or more positive for CURB 65. And I know sometimes you may hear 3 or more, but no, guidelines say 2 or more, okay? C, 1 or more, no, like I said, it's 2 or more. And then D, CURB 65 is used for treating. It's not, it is actually, like I said, is utilized for scoring the severity of the pneumonia and when you should consider referring them out for a higher level of care in inpatient management, okay? All right, you guys, I hope you found this helpful. Some of my question styles, I like to throw in various things to also help build your knowledge as you're studying. It's always a method in my madness. So I am giving you things to learn how to apply it, but also throwing these things that I commonly see people trip up on in one-on-one sessions to help you guys as you're studying. So I really, really hope you're finding it helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure you meet me back here. If you need any of my resources, feel free to call the Nursing Studio at 803 400 6864 or shoot us a text at 803 400 6864, or you can shoot an email to the nursing studio, the number one, at gmail.com. Now, just a quick rundown of what I offer. I have a review book option that you can get either from ebook option or the paperback option shipped to you, right? So it's broken down by system. It works for family and adult gero. Now, family primarily because it does have a pediatric section in it. But I have adult gero reviewers that have utilized it as well. Just I always say just skip the ped section. It's at the end for a reason. Just skip it. It is designed for AANP as well as ANCC. I have a non-clinical section in there. Each system is broken down, in the way that I always tell y'all to review your assessment, your diagnosis, evaluation, treatment. Each system has an interactive section that is fill in the blank as well. So after you read and review the short and sweet, quick way, then you go and fill in the blank and test your knowledge. And it's broken down level one, looking at those signs and symptoms, being able to recall how that diagnosis presents, for your assessment, right? Level two, the diagnostics, those gold standards. Level three, evaluation and treatment, So I'm taking you from reading it to writing it out and then testing your knowledge with the practice questions at the end with rationales, okay? It is in color because I have images to tie it all together. If you're a visual learner, that's good for you. That's how I am. So I try to cover all bases for all learning styles. So again, that's an ebook option or paperback. Of course, once purchased, you can the ebook, you'll have access immediately on any device that you utilize it on. Great resource for studying on the go if you're just trying to quickly review. Now, both of those are linked in the bio of this channel. Also, I have a self-paced independent review course broken down same way, has many quizzes per system for family and adult gero, for ANCC as well as AANP. It's me teaching on videos, breaking it down, going through all of the material in a short, sweet fashion for you to review. This is also linked in the bio of this channel. Now, 5-week review, I do group courses of that, and I do it periodically throughout the year. Our next one is June the 10th. I have one space still available for that. I try to keep this class small because during the 5 weeks, I give you assignments Monday through Friday. You're able to complete them at your own pace. We meet weekly for live practice questions to work through, just like how we do here on the channel, but you're live with me. If you missed the live session or not available, the replay is available for you. But the reason why I keep it limited with the amount of people in the class, because on the last week, it's an individualized week where I work with each individual for a session to gauge the assignments that you have submitted, your progress, to see your exam readiness currently, and give you any advice on what to do or how you should proceed after completing this course. And that is linked in the description of this, and you can see it all. It's on many videos and also in the the post section of this channel. And then the one-on-one sessions, I always say, if you're looking for one-on-one, because I do one-on-ones based off of your weaknesses, if that's something you need to just focus in on, like one area, or if you want to do an exam readiness assessment with me, that's another option of one-on-one. And then we have the custom plan option for one-on-one for people who may have been unsuccessful before or may not know where they are and how to study and need a little time, structure, and someone to work alongside with them. That is the custom plan, and it's really based off of how long you want to review and what you need. So I always say, call me, shoot an email to the nursing studio so that we can discuss this and gauge what you really need, because it's customized. So I can't just say, hey, this is a set rate, this is this. It's really based off of what you're doing, what you need. So feel free to reach out to me so we can get that figured out and planned if that's something you need. But even if you don't need any of these resources and practice questions are helping you with your studying, this is why I do this, because, everybody has their own plan. They're in different spaces. And I just wanted to give y'all a resource that lets you learn how to take your knowledge and apply it. So I'm hoping that you are finding this helpful. And just meet me back here. And as always, happy studying. Bye, y'all.